In this section, we'll be discussing regarding the ATS or ERS classification of ILD or interstitial lung disease. Basically, it's divided into etiological causes and non-etiology causes. The non-etiology causes can be remembered as DOXY. D for drugs, which includes nitrofurantoin, imidazole, methotrexate, and chemotherapy regimens. O for organic exposure induced ILD, birds, hay, molds, mycobacteria. C for connective tissue disease, rheumatoid arthritis, scleroderma, Sjogren's syndrome. S for smoking, which includes 3 disorders: DIP, diffuse interstitial pneumonia, respiratory bronchiolitis, interstitial lung disease, and Langerhans cell histiocytosis. I for inorganic exposure, asbestosis, silica, hard metals, and coal dust. Remember it as DOXY. Now, what are the idiopathic or unknown causes? The first comes the rare forms of ILD like LAM, vasculitis, fibroelastosis. Then granulomatous causes, which includes sarcoidosis. You should remember that sarcoidosis comes in the idiopathic or unknown cause rather than connective tissue disease. Then comes the idiopathic interstitial pneumonia, which is in turn divided into IPF and non-IPF category. The the causes coming under non-IPF is NSIP pattern, COP, cryptogenic organizing pneumonia, lymphocyte interstitial pneumonia, and acute interstitial pneumonia. 4 causes. Thank you.